Hello, I'm Dr. Jerry Mixon, and you are watching a little video we're going to do on breast cancer today. Now, there's a couple of things that I want to get straight that are subjects of misinformation. First, estrogen does not cause breast cancer. That's an outdated concept from, golly gee, 20, 30 years ago. There was a study in 2001 that scared the bejabbers out of everybody because the study seemed to indicate that estrogen hormone replacement therapy raised the risk of breast cancer by 27%, and of course estrogen prescriptions dropped to the floor. The problem with that study is that it wasn't just on estrogen. That study used conjugated equine estrogens, that is, estrogens extracted from the urine of pregnant horses, along with a drug called Provera, which is medroxyprogesterone acetate, not real progesterone. It's a progestogen. And this particular progestogen increases the risk of breast cancer by about 67 to 70%. And so that 27% rise that we saw in that study that scared everybody was actually estrogen lowering the risk of breast cancer about 30%, coupled with the synthetic progestogen that raised at 67%, and the net impact was a 27% rise. They went back and looked at that study again about 10 years later and took a look at the women who got only the estrogen without the synthetic progestogen, and they found some fascinating things. What they discovered was that when those women got just estrogens, heart disease went down about 40%. 40% fewer heart attacks in women. Stroke stayed the same. Breast cancer went down about 30%. Colon cancer declined about 40%. Who'd have thought that estrogen was protective against colon cancer, but it turns out that it really is. Fractures went down, of course, because the estrogen slowed bone loss and the women didn't get osteoporosis as quickly. And deaths from all causes dropped about 20 to 23%. That was fascinating. As you can see, heart attacks down, stroke stayed the same, blood clots went up a bit, but it didn't cause strokes to go up. These were local blood clots in the legs. But breast cancer went down, colon cancer went down, fractures went down, deaths from all causes went down. That was a revelation. No doctor should still be thinking that estrogen causes breast cancer, and this is a clear indication that it does not. Now, the next graphic that I've got up on your screen, this is hormones and breast cancer. And if you look at that, down at the 20 to 25 year range, the women had their highest levels of estrogen and progesterone and their absolute lowest levels of breast cancer. Between 30 and 35, estrogen is starting to drop a little bit, progesterone is dropping a little faster, and breast cancer is starting to rise. And the rise continued until around 45 years old, when the breast cancer was rising rapidly, and that was because the estrogen and progesterone levels were dropping like stones. By the time we hit that crossover point about age 50, women have lost about half their estrogen, they've lost 2/3 or so of their progesterone, and breast cancer is continuing to rise. And if you look, you'll see that estrogen levels hit their nadir at about 75 years old. Progesterone bottomed out at about 70 years old. Incidence of breast cancer got as high as it could get, plateaued, and when estrogen couldn't go any lower, breast cancer didn't go any higher. Again, clearly, the estrogen was protective against breast cancer, not the cause of breast cancer. If estrogen caused breast cancer, we would expect breast cancer to be most common in those 18, 20, 25-year-old women, and very rare in 75-year-olds who have almost no estrogen left. So, first important point, estrogen does not cause breast cancer. Now, there's one other hormone that I did not put on that graphic, and I'll show that one to you now. This is testosterone, and this is women's testosterone level over age. And it turns out that as women are aging, their testosterone level is rapidly dropping too. And as testosterone levels are dropping, guess what? Breast cancer is rising. What we've really got is a situation in which we found that testosterone is highly protective against breast cancer. I have a whole different presentation on that, so go look for it, and when you see that, you'll see that women who get testosterone in midlife before menopause have a profoundly potent protection against breast cancer. But I'll save that description for the next one. The next question here is, what happens with breast cancer? Well, breast cancer starts with one cell. One cell. That breast is being starved for estrogen as estrogen levels are going down and down, and progesterone levels are going down and down, and testosterone levels are going down and down. And at some point, somewhere in those billions of cells in your breasts, one cell undergoes a mutation in which it's able to produce its own hormones. Now, it doesn't produce testosterone because testosterone would keep it from growing. What it produces is estrogen and growth factors and all sorts of triggers to decrease the inhibition of growth and help that cell to essentially become immortal and replace itself over and over and over again. So one cell, after anywhere from 30 to 100 days, becomes 2 cells. Another 30 to 100 days becomes 4 cells. And then another 30 to 100 days becomes 8 cells, and it continues to snowball. But interestingly, the average reproductive stage of a breast cancer cell is 2 to 3 months. Now, that fastest one that only changes every 30 days, that one will get big enough for us to find the cancer in about 3 years. That slow one that takes 100 days, that cancer won't be found for 10 years. The average woman has actually had breast cancer for an average of about 5 years before we discover it. So when a woman says, "Oh my God, I was just diagnosed with breast cancer," we think, "Oh, she just got breast cancer." No, she's had it from 3 to 10 years. On average, she's had that disease for 5 years. We have seen this too often that people mistake the discovery with causation. They'll do something like start on their estrogen pills for menopause, and a year or 2 later, we discover a breast cancer. Well, that cancer was there anywhere from 1 to 10 years before she started the estrogen. But in the olden days, they made that mistake. They had not really looked at it, so they thought that perhaps we were causing the breast cancer. Simply not true. But now, if you get a breast cancer, what can you do to enhance your survival? And that's really the thrust of this exercise. And I use the word exercise advisedly because it turns out that if a woman who is newly diagnosed with breast cancer, that is, we now know has actually had that cancer an average of 5 years, and we put that woman on an intense exercise program, you will improve her chances of surviving from breast cancer by 60%. We used to think it was 30%, but the newer studies are now showing intense exercise, a woman that really gets out and spends 3 hours a week or more in aggressive exercise can increase her chances of surviving that breast cancer by up to 60%. Now, all exercise helps. A little bit of exercise helps a little bit, but as you increase exercise duration and intensity, working muscle is producing something we call myokines. And working muscle, we now know, produces over 300 different factors that enhance your immune system and help your immune system to find and kill cancer cells. It also increases the rate of apoptosis, that is the rate at which old cancer cells die. So the cancer starts dying faster. So any exercise you can get is a big help, okay? Up to 60% improvement in survival. Body fat. The fatter you are, the higher your risk of getting breast cancer. And the higher your risk of dying from that cancer. Body fat increases, so does the risk of dying. And here's a fascinating number. They've actually gone back and looked at your lifetime obesity schedule against your risk of dying from breast cancer. Normal Americans or average Americans, they are obese. They get about 20% more breast cancer than slender women. Okay, so if you've gained significant amount of weight, you've got about a 20% increased risk of breast cancer. But here's where they've even quantified it better. Go back to where you were as a teenager, 18 or below, okay, say 15, 16, 17 years old, when you were probably at your slenderest in life. Every 11 pounds of weight you have gained since your teen years increases your risk of breast cancer by about 7%. So if you gained 22 pounds between 17 and today, you've increased your risk of breast cancer by 14%. If you've gained 33 pounds, well, now you're up to 21%. If you've gained 44 pounds between your teens and now, guess what? You're up 28% risk of breast cancer. It's a simple calculation. So go back and look at when you were at your leanest and fittest in your teens. Go get on the scale today. Every 11 pounds equals a 7% increased risk of getting breast cancer. And every excess pound of body fat increases your risk of having aggressive cancer that will kill you. So if you're a woman who is worried about breast cancer but don't yet have it, here are my rules. Okay? First of all, get lean and take up vigorous exercise, a minimum of 3 hours a week. If you are a woman who has been diagnosed with breast cancer, get lean and take up that exercise at least 3 hours a week. Your life depends on it. I don't know how to give you a more compelling incentive to exercise and lose weight than that. You have a 60% less chance of dying from that cancer if you will get lean and exercise at least 3 hours a week. I hope this will save a few lives. It certainly should help America become a bit leaner, more active country, at least all the women. Of course, I'm going to talk about prostate cancer in a little bit because guess what? Prostate cancer has the same general trend. The fatter men are, the higher the risk of dying of prostate cancer. So get the men in your life out there moving too, and whoever does the cooking in your family, cook lighter, smaller, less fat, less red meat meals. I'm not telling you to become a vegetarian. Humans are made as omnivores, not veggies. But I want every American to get as lean and fit as they can because it'll save the women's life from breast cancer. It'll save the men's lives from prostate cancer. Thank you very much for watching so far, and there's a lot more of these to come.